I want to talk a little bit about recurrent decay, which is a cavity that forms around or under an existing restoration. Here we have a gold crown, and many times I hear the patient say, how can I possibly get a cavity in this tooth? It's a fake tooth. Well, the crown, which is the fake part, still holds on to your natural tooth. It's still in your mouth. It's just shaped down for a crown. But right here, and the crown is cemented over it, right here where the crown meets the tooth, it's called the margin, is a weak spot. And that's where a lot of the times patients will get recurrent decay. It can happen anywhere around the tooth. It can happen on the cheek side, in between the teeth, or on the inside right there. So pretty much all the way around. So just because you had a restoration placed, a filling or a crown, doesn't mean that you cannot get a cavity in this tooth again. So it's still very important to brush and floss and look after your restorations. Same thing with the filling. A patient will say, I already had a filling in the tooth. How can I possibly get a cavity again? Well, where the filling meets the tooth, at that margin, you can have some leakage, and the bacteria will make their way right at the junction between the filling and the tooth and kind of eat at the tooth under a filling. Also with fillings, sometimes we have a filling, let's say, on the chewing surface of the tooth. But every tooth actually has 5 surfaces to it. So we have the chewing surface, we have the cheek side, and then the tongue side right here, as well as the 2 surfaces right in between the teeth. So if you had a filling on the chewing surface of the tooth, well, you can still get a cavity on the chewing surface of the tooth around the existing filling, or on any of the other 4 surfaces, or a combination of surfaces. So please continue brushing, flossing, get your regular checkups. We always check all the margins of the existing restorations to make sure everything is holding up well and staying healthy.